I know that while I begin to quit smoking, if I'm going to smoke, I must do it responsibly. I must think about the neighbor that has COPD. I must think about the young child with asthma.
A lot of residents want to change their conditions, but you can't change not unless you have the knowledge. Again, that's when the health components come in. Just having a love and a support, they can overcome it.
I've been smoking all my life. I'm 61. And as I gotten older, I've gotten sick through the smoke. I didn't think about the apartment next door to me, or I didn't think when I was at the bus stop, the people around me. The fact that there is a smoke liaison here in NYCHA, it opened my eyes, and I noticed that it's starting to show more and more people that it is a danger.
NYCHA is a city within a city. As the largest public housing authority in the United States, we serve nearly 340,000 residents.
The smoking prevalence in New York City has decreased by over half in the last decade, but that progress definitely hasn't been experienced equally by everyone. And a lot of NYCHA residents experience more factors that encourage smoking, and I think we've seen that reflected in the smoking rates that they experience. In 2018, there was a federal HUD rule that went into effect that made all public housing buildings smoke-free, including individual apartments.
Smoke-Free NYCHA is dedicated to creating healthier environments for our residents as well as our employees by reducing the exposure to secondhand smoke and connecting those who are interested in quitting or cutting back to the resources that they need.
Reframing tobacco treatment to really focus on what people's goals are. Maybe they want to quit smoking, but maybe they want to cut back, or maybe they just need help avoiding smoking when they want to. So whether that's at home, it's at work, it's in other public spaces, how can we support them in staying smoke-free in those times or in those spaces, and using medications to help them do that and stay comfortable and avoid withdrawal symptoms.
We know that the smoke-free policy represents a really big shift in norms for our resident community. They've been in their homes for generations. It's going to take time and support to really build that adherence and change the culture and create that smoke-free environment that we all know is possible. We developed a team of community health workers who have real, authentic experience living and working within NYCHA to be those conduits of information and support that our residents had requested.
Congratulations on this new journey. So there's so many different forms of medication you can take for cutting down or quitting smoking, right?
A lot of residents want to quit, and I'm here to be there for them. You want to quit? Let's do this together. You're not alone at this journey. We can do this.
It is very scary to quit smoking. I am nervous about it, but I'm also very excited because of the support that I have from Shatara and Smoke-Free NYCHA.
I have an investment in the community because I'm also a resident myself. We all share the air, so I want to just try my best to incorporate a healthy environment. I engage people where they're at.
So when Mr. Thomas came out, I was truly stunned because he was very, very dedicated to it. He spoke with the tenants. He wants to give us whatever literature that we need. He's willing to bring the patches, whatever it takes to help those people that really want help. He's always there for us.
I get to share this amazing information, and they can take those tools and put it towards a better environment and cleaner air for them and their families. And I'm empathetic because I've been there. I am a resident. I was a smoker. I do have a family, and I want them to understand that I understand what they're going through.
That's what's gratifying for me, is to be able to help and see a process through where someone who quit smoking and is able to say, yes, I did this with the help of a liaison.
It's hard to quit, but I'll get through it. And then I could be an example to someone else who's trying to quit. If I can do it, anybody can do it. And I'll be there to support them just as I have the support in place that I now have.
We want to reach not only just the little ones, but the older ones and the elderly ones, and let them know, even though they may want to continue to smoke, think about what you're doing to your family. Think about the health risk that's really coming behind smoking these cigarettes.
Who doesn't want their life their homes to be healthy, for their kids to grow, for their animals to play, for their grandmother to live a longer life. And with smoke-free NYCHA support, we can work together to make sure they have that.